Hi, my name is Mike Heenahan, and I'm the Fellowship Director for the Sports Medicine Program at O'Connor Hospital. And in this session, we're going to review some exercises for low back pain. The exercises we're going to demonstrate are what we feel are the most effective and the easiest to do. There are literally hundreds we could choose from, but these are the ones that we think are the highest yield for you. These exercises should be done in conjunction with a regular exercise program, such as walking, swimming, or cycling, and they're best done on a daily basis. We find that's the most effective way to do it. It should be done when you're slightly warmed up too. I'd suggest a 5 or 10 minute walk and then do these exercises. There shouldn't be much discomfort. You'll feel a little pain with stretching, but that should be fairly minimal, and it certainly shouldn't persist to the day after the exercises. And if you're getting that type of pain, then you should definitely check with your physician or therapist before proceeding. The best way to review these exercises, first start with a little bit of an anatomy lesson here so that you can see what we're trying to do with the exercise program. This is a model of the lumbar spine. This is the front, the back. These are the spinous processes. These are those knobs that you can feel if you reach around behind your back. These are the bones, the vertebral bodies, and the intervertebral disc. And when somebody has a slip disc or a herniated disc, this will often press back on the nerve root, and you can see that here as it comes out from between the bones of the spine. The spinal canal is in this location, and the spinal cord runs in the center of the spine. The exercises that we're going to demonstrate are designed to help strengthen the muscles that are on the front of the spine to help stabilize it, as well as the muscles that are on the back of the spine. We're going to start first with some exercises to help with the flexibility of the back. This first one is hip rotation. So we're going to bring the knees up. And what you want to do is just gently let your legs fall to the side. First one way, then the other. And with all the exercises in this series, with demonstrating the flexibility, all you need to do is a couple of rotations. You don't need to do any more than 2 or 3 of these rotation type of movements. The next one in the series is called a pelvic tilt, and there's two varieties of this. One is front to back and the other side to side. We'll demonstrate first the front to back. What I like to do is slip my hand under a patient's back and to demonstrate how to do the movement, ask them to press against my hand. And as their pelvis rocks forward, that's the movement that you want. So essentially you want the pelvis to drop back and then rock forward. Back and forward. And this should be done 2 or 3 times. It should be done nice and slow. It's a very gentle exercise. The second part of this is the pelvic tilt, the side to side. And with this one, you're going to actually move the hips side to side, similar to what you just did with the other pelvic tilt. But the pelvis rocks one way and then the other. And those are intended to help stretch out the muscles, the large muscles on the back, right next to the spinal column and on the side. The next exercise is a hamstring stretch. And with this one, we're going to demonstrate this lying down, but this could be done putting your leg up against a chair or a table that's at 90 degrees, or using a door frame. But I think you'll be able to see from the demonstration here how you would do that. So you want to bring the leg up, and imagine that my arm is the door frame. So the patient would put their leg up against the door frame, and you want to position your hips so that they're comfortable, so that you have a stretch on the hamstring, but it's not too tight that it's causing a lot of discomfort. And after about 20 or 30 seconds, the muscle will begin to relax, and then you can slide your hips down a little bit, which effectively brings your leg up if you're using the door frame technique. The key to this is to spend enough time with your stretches. It takes probably 20 or 30 seconds for the muscle to relax, and then you add that additional stretch. And you'll want to do that 2 or 3 times for a total of probably 1 to 2 minutes at least with each hamstring. Very common mistake that patients make is they don't stretch for a sufficient length of time or isolate the hamstring using this technique. I don't recommend bending down to touch your toes as a way to stretch because it really loads the low back. I think it's worth spending just a second here to talk about why it's so important to do a hamstring stretch. Because we're talking about the back, why would we be talking about the legs here? The hamstrings actually control the lumbar spine, and if they're very tight, then it locks the spine sooner than it should for a movement such as bending down to pick up a ball or some other object. And when that happens, you load the low back, and that's where you're likely to get an injury. So stretching the hamstrings becomes a very important and a very key exercise. The next thing that we're going to demonstrate is stretching a small muscle called the piriformis as well as the hip. And with this movement, you bring the knee up, and then you're going to pull your knee towards the opposite shoulder. So the patient's just bringing that down, nice gentle stretch. And again, as with all these flexibility stretches, it should be held for 20 to 30 seconds, and all you need to do is 1 to 2 repetitions on each side. This next set of back exercises is designed to help strengthen the back. So in addition to the flexibility, very important that you work on some strengthening. And as I demonstrated using the anatomical model, we want to strengthen the muscles on the front of the spine and the back of the spine. These are the so-called core strengthening exercises. We'll start first with abdominal strengthening. And this is a so-called crunch. So I'm going to have the patient bring their arm up behind their head. This could be done with the arms crossed too, if you're more comfortable in this position. And we'll bring the knees up, because you want to unload the back a little bit. And then to do a crunch, all you need to do is come up about 15 to 20 degrees. So come on up and then back down. And you'll hold it for just about a second and then drop down. And you could do essentially as many of these as you want, but I'd suggest you start out, if you haven't been doing them, with maybe 10 to 20 and then go up from there. And you want to do this on a daily basis. I don't suggest that you go ahead and do a full sit-up, and once you just demonstrate a full sit-up here just to see what not to do, and then come back down. Because the first 15 to 20 degrees of this movement is using the abdominal muscles, and beyond that, you're just loading the low back. You don't get any additional benefit, and you run the risk of developing a back injury. So just stick with the crunches, just coming up 15 degrees. We'll demonstrate that again. Great. The next set of exercises are to help strengthen the muscles on the back of the spine. So I'm going to ask our patient to get up on her hands and knees here. And this is the muscle group back here that we want to strengthen. So she's going to level her back here, and then she's going to raise her right arm and left leg. And as you can see, it requires some balance, which is helping to strengthen these muscles, as well as the extension type of movement, which is very effective at stretching the muscles, strengthening the muscles on the back. And then you come back into a neutral pose, and then you're going to do the same movement pattern on the other side. Again, hold it for the count of 1 to 2 to get about a 2 or 3 second hold there. And then you come back to the neutral position, and then you would just repeat that. I suggest you start with maybe 10 repetitions, and then you can go up from there. The next one is the sitting leg lift. So I'm going to have the patient sit on the table with the legs out in front. And this is a very simple exercise. We call this our television exercise, because you can actually do this when you're sitting watching TV. And all you do is essentially raise the leg up, hold it, and then bring it down, and then do that on the other side. That's helping to strengthen again, those core muscles that are on the front of the body. So you can go ahead and let your leg down. This next back strengthening exercise is called a wall squat. And to do this, you start out leaning against the wall, take a step away from the wall, and then reposition yourself as if you're leaning down to sit on a chair, even though there's no chair there. And then you slide down to put a load on the quadriceps muscle, so it's helping to strengthen these muscles in the front of the body here. And it's also strengthening the core muscles in the front and the back of the spine, because you're engaging those muscles to stabilize in this position. You hold this for about 20 to 30 seconds, and then you can relax, stand up, and then repeat it. And you want to do this 2 or 3 times.